Glucocorticoid-induced osteoporosis. Definition: Glucocorticoid-induced osteoporosis is a form of osteoporosis that is caused by taking glucocorticoid medicine. This drug includes prednisone, that is called deltasone, orasone, and etc. Prednisolone, called Prelone, dexamethasone, called Decadron, Excedrol, and cortisone, that is called Cortodone. Now we have to see a video that is the bone of metabolism.
In 3 different ways. So the first way is it's actually Ashland's quick and dirty video on bone metabolism. So first, before we can understand how glucocorticoids affect bone metabolism, let's look at the normal situation in the human body. So here we have our white lines on the bottom and on the top, and you can think representing any bone in the human body. We have our pink rectangles, which are going to be our
So here we can see the metabolism of the bone and how the mature osteoblasts work.
osteoblasts, and we have this blue jellyfish over here, which is going to be our mature osteoclast. Just as a quick reminder, the osteoblast is going to be the builder of our human bone, and the osteoclast is going to be that catastrophic cell which literally chews holes into our bone. Okay, so it reabsorbs all of our bone there. And both of these are important when it comes to bone metabolism. So now we're going to go ahead and focus on how we get this final mature osteoclast through this process called osteoclastogenesis. So let's go ahead and zoom out. Wow, look at all these things. So first, we have a cell from our macrophage lineage that's going to go through a series of steps. It's going to become that immature osteoclast. And then, through another series of events, we're going to get that final mature cell, which is going to have that function of reabsorbing bone. So, for the purposes of this talk, I'm going to focus on how the osteoblast actually helps facilitate and regulate that process over there. So let's zoom in really quick, and we see these red circles that are actually being produced by our osteoblasts. We're going to call it rank ligand. So the rank ligand that's produced by the osteoblasts is actually going to bind to something known as the rank receptor. So this rank ligand is going to go ahead and bind to the rank receptor on the immature osteoclast, and that's going to stimulate the immature cell to become that final, lovely, jellyfish-looking mature cell that chews into bone. And also, like any good metabolic process, the osteoblast is also going to produce something that inhibits this pathway. And it's going to produce something called OPG. So OPG is actually going to inhibit this immature cell from becoming that mature osteoclast cell that chews into bone. So again, just as a quick review, the osteoblast produces rank ligand, and that facilitates this mature cell formation. And it also produces this little molecule called OPG, which absolutely inhibits that mature osteoclast formation. So now that we know a little bit about the normal bone metabolism situation, we can go ahead and zoom out and talk about how glucocorticoids might affect that process.
Okay, continue with the slide. Application in nursing. First, we have acid and contrapay, that is meaning that patients often complain of back pain, like collapse of the vertebra or pain from a fracture. Pain control is essential for the patient to participate in rehabilitation. And the second, we have the monitor respiratory status and sign of back embolism, that is important and help with the repositioning. And the third, we have the manage medication appropriately, because the medication is for to decrease bone loss. Okay, continue with the video. Here we'll observe the process of increase range L and the inhibit OPG and how the glucocorticoid work.
The process that we just described in 3 different ways. So the first way is it's actually going to increase the production of rank ligand. So on the osteoblast, there's actually a glucocorticoid receptor. The glucocorticoid comes over, binds to the receptor, and stimulates the production of rank ligand. The more rank ligand you have, the more immature osteoclasts are stimulated, the more mature osteoclasts are formed, and the more bone you have chewed up and reabsorbed. Another thing that the glucocorticoids do is they're going to increase the expression of the rank receptor. So not only do you have glucocorticoid receptors on the osteoblasts, you also have glucocorticoid receptors on your immature osteoclasts. So your glucocorticoids are also going to bind to your immature cells and going to increase the expression of these little green boxes known as rank, and then you're going to get more of that formation of the mature cells, which are going to, again, reabsorb that bone, chew it up, destroy it, however you want to think about it. And the third thing that glucocorticoids are going to do is suppress the secretion of OPG. And so OPG, again, was the thing that the osteoblasts were producing to inhibit immature progression into a mature osteoclast. So if you inhibit this inhibitor, you're going to actually allow more mature osteoclasts to be formed. So essentially, in a nutshell, these 3 ways that glucocorticoids affect this pathway over here, it's all going to favor bone reabsorption, which is why glucocorticoids are often associated with bone fractures and a ton of other things. And we're actually just going to very quickly go through a few other ways in which glucocorticoids not only stimulate bone reabsorption, but also inhibit the production of bone. Here we have a little summary table of some other ways that glucocorticoids can really affect bone reabsorption and bone formation. So all these factors on this side of the table are going to facilitate bone reabsorption, and they include decreased serum estrogen and testosterone. Glucocorticoids increase your urinary calcium, so they increase calcium excretion. They decrease calcium absorption by your GI tract, and these 2 things here are going to result in that increased production of parathyroid hormone, and that's going to facilitate bone reabsorption. And if we move to this other side of the table, we have a bunch of things that facilitate decreased bone formation. So glucocorticoids also have direct action on bone cells that we have not talked about, and this includes inhibition of osteoblast formation as well as apoptosis of osteocytes. So we can imagine that decreases the bone formation. You have a decrease in serum testosterone as a result of glucocorticoids and a decrease in muscle strength, all things that decrease that bone formation. And if we look at the big picture really quick, the decrease in bone reabsorption and the decrease in bone formation is going to ultimately mean a decrease in bone volume, aka osteoporosis. Welcome to
Okay, as you can see at the end of the video, how is the similarity of bone resorb and the bone formation. And the bone resorb how increase and decrease production, and the other side of the bone formation uh, all is decrease and the muscle strength. Here we have 2 medications and we will see their pros and cons. Bisphosphonate. The pros is greatly reduced chance of fractures caused by fragile, weakened bones, and its effective result with hip fracture reduced by half and spine fracture by 17%, and benefit continue even after you're no longer taking the medication. And the cons is the side effects include upset stomach and heartburn. And 1 in 60,000 people developed jawbone problems. In 1% of users, bisphosphonate can cause a broken thigh bone and call it a femoral fracture. And the hormone therapy, the proof is you can take other medication. Hormone treatment can be an effective alternative. Some of hormone treatment can help your body grow new bone if your bone density is low or you already have broken bone. It, it significantly improves bone density in your spine. And the count it may increase your risk of certain cancer and recast, and the side effects can include dizziness, fainting, and lightheadedness. It may cause blood clot or stroke. Issues applied in Ecuador. Glucocorticoides are the primary cause of secondary osteoporosis, being an independent factor of morbidity and mortality. In this patient, because the progressive loss of bone mass and increased risk of fracture begins shortly after the start of treatment with glucocorticoids. It is important to identify and, if possible, to correct risk factors and comorbidities in this group of patients, initiate preventive measures, and provide health promotion tips, such as change of habit and give calcium and vitamin D supplement, in addition to treatment specific. It is important to identify and, if possible, to correct risk factors and comorbidities in this group of patients, initiate preventive measures, and provide health promotion tips such as change of habit, and give calcium and vitamin D supplements in addition to treatment specific. In conclusion, osteoporosis is a systemic skeletal disease characterized by decreased bone mineral density with alteration in bone microarchitecture and increased risk of fracture. Thank you.